this presentation is one that I did that's just pretty basic about what TPN is and the components and all that. And then Susan had a lot of information that was nursing related. So I just printed it all out, so whatever you don't need, you can throw away.
Well, well, I guess what I want to do is the TPN. The milrinone, it's pretty much setting up the pump, and then teach for that milrinone in home is for you guys to watch them hook it up again. Okay. And so that's not as involved as, but then as involved. And the other part is, of course, you're the home health, and so you're doing the dressing changes, and so I brought out a lot of our equipment that we have on hand for that, just because that's you guys know. I have to think about that. So I give them this book. I go into the home, and I'm not in the home necessarily. Actually, we have somebody that may need to be taught in their home for the very first time. See how, if y'all want to go, somebody wants to go with me, then that would be a good thing. And really that was how I learned. I went with Jerry a couple of times and watched, and Jerry is the other RN. We usually try to teach this in the hospital before they get discharged, and not the TPN so much. I don't know who taught me that one. I can't remember. Anyway, Brock, maybe I observed somebody do a teach, and then that was it, pretty much. And actually, with the milrinone, I observed several of them. I was for a couple of weeks. So we talk about the book. I mean, I open it up and I tell them, okay, this is a place to document your physicians, and I'm sorry, this is going to be slow. I'm going to go do what I do.
That's fine, Susan.
Okay, because I have since then taught several bunches of nurses and experienced nurses, but I figured out, oh, it's just to go through the book anyway.
Exactly.
And then I answer all their questions. And so anyway, so I talked to them about putting their healthcare providers in this book. If you guys want to write that list down for them, sometimes you can get it in the chart if you have time. I don't necessarily do that because, but what I do tell them is, most folks have a book for their home health care. They've got a book they've got numbers in their phone. And the whole idea of putting it in one place is so that a family member or somebody that's taking care of them has a resource. And it's just one area. So, I mean, I strongly suggest it. I put down the home health agency's name in here. I don't necessarily know who the nurse is, but I'll put down the company. I also put down my name and my cell number. Having said that, I do say we are available 24/7, available. And if you have any kind of problems with your pump, or you have any problems with supplies, then you would want to call us. If you're sick, you want to call your home health. But certainly, if you can't reach anybody, I would like you to call me. I don't want you to feel like you're alone. And this is my cell number. I'm there. Having said, I don't usually get calls. I mean, they usually will go to us, the company first, or their home health care, or their physician if they're having medical problems. And of course, that's y'all. So you do want to be. I'm forgetting, you are the home health. We will be the home health.
Right. And we'll probably have them go through the 917 number.
First.
Yes.
Yeah, I mean, they do that. They do that.
Because when you build up a huge volume of patients, they just can't have your cell phone number. I've been in that before, and it can be a nightmare.
And purely from a marketing standpoint, too.
Yeah, and we're supposed to also be keeping an on-call log.
Documentation.
Exactly. So they really need to come through the 917 number.
Well, a lot of times,
and
supplies only. Why bother Susan with the supply only?
Exactly.
And so if it's a medical issue, what will usually happen is the on-call person will call me. And as I said, they usually go to this, but I do provide that, and that was something that somebody, that I was taught to do, and I thought, okay, I can do that. And I think out of all the numbers, and I think I've done a lot of TPNs at this point, and as far as that goes, I don't know how many in the last has it been 4 or 5 months? Probably, well, maybe not that many, maybe 50, 60. And out of that, I don't think I've gotten very many people calling back. Every once in a while, one person will. Usually, you know, the one person that did, it was a child.
Mm-hmm.
And I mean, I was glad to be there for them. The next thing is calendar in here, and it's got a place for weight. And I tell them, of course, it's documentation for this. For them, you want to have their weight in here. You recommend that they take a baseline temperature every day. I hit on the fact that the biggest risk of getting most of this medicine is the IV. That you can become bacteremic with that, or you know, get an infection through your IV, and so that's one of the biggest risks. So unfortunately, with kids, with people who have children, and I do teach this with children, the physicians are a little bit more on it when you have to call and say, hey, my kid's got a temperature. With adults, you really have to have some kind of documentation, and I really say, well, if you have taken your temperature every day and it's 97.8, and that's not, you know, 97.8 is kind of a low grade. But people do that, 97.8, and then one day you wake up and it's 99. Well, that's a low grade temp, and most folks are going to blow you off. But if you can say, well, you know, I take it every morning, it's 97.8, and today it's 99, and I really feel bad. You know, that's the other part of it. Or if you spike a temperature in the afternoon, lots of folks, if they're going to have a fever, it comes in the afternoon, and so you can have that comparison. This morning I was 97 every day for the last, you know, month. And today, so unfortunately, physicians, they want, and doctors' offices want that kind of what are the documentation? I want to say
Detail.
Yeah, detail. It's not subjective but objective documentation, and you know, I can bring it in or I can look at it. I mean, it's hard to argue with, and then I share that with them. I mean, you know. The next portion of this talks about parental nutrition, and I do I go pretty fast through this, and the reason, and your book is not necessarily like this, I'm sorry. We'll see if she has those. And it does, it's pretty basic. This is put out by ASPEN, and ASPEN is the American Society of Parental and Enteral Nutrition, and they're pretty much the gold standard. Physicians, I mean, I've heard these girls, our nutritionists, say that the doctor's going by the ASPEN recommendations.
We do have a book in the office that I ordered for us.
For ASPEN? Yeah, I mean, it's the gold standard, but having said that, I mean, I've seen those prescriptions, and it's pretty much what our labels look like. And it's something that they figure out, and they're able to figure out through the lab work and stuff. I think you have to have a certain certification. I'm pretty sure the nutritionists are certified, and I don't necessarily always share that with the patient's family, but I do like to mention, because you'll see this ASPEN logo on there, it's the gold standard. It's what our physicians use and our nutritionists. It talks about what is parental nutrition, and depending on the knowledge base of the patient. Total parental nutrition is TPN is total parental nutrition. It's IV nutrition, and I know you guys know that, but it talks about what are the common causes that you have for this. And I need a Kleenex, excuse me.